Hi, I'm Dr. Greg Grillo with Express Dentist. For the past 27 years, I've been dealing with a lot of dental problems. One of them is a tooth abscess or dental abscess. We see those almost every day. And an abscess can be fairly painful. It can radiate pain into your face, up into the top of your head, into your jaw, down into your neck. And there can be other symptoms as well. It can be very difficult to eat, for example. And the sooner that you get an abscess taken care of, the less likely you are to have a serious complication. And you get out of pain, and you're more comfortable, and you're more likely to be able to save your teeth before more of the tooth or the bone and gum around it is damaged. So there are different types of abscesses that can occur, but basically the inside of the tooth is the pulp. And in the pulp, there's nerve and blood tissue. And when bacteria get into that closed off, sterile space, it becomes an infection. And an infection starts to inflame the nerve, and teeth can't swell themselves because they're hard. And so that pressure presses against the nerve and causes significant pain. After a while, the bacteria migrate down the roots of the tooth and out into the jawbone. And once they get into the jawbone, then it starts to swell in bone. But bone doesn't swell very well either. And so that can become very uncomfortable as the pressure builds inside the bone. Eventually, infection from the pressure needs to go somewhere. And so what it will do is find a way out of the bone. So it's found a way out of the tooth, finds a way out of the bone, and then it gets into the face. And once it gets into the face, it can travel fairly extensively, and that's where you get swelling starts to occur, and it can radiate. The swelling can go up underneath the eye, out to the side of the face, down into the neck, and in some cases even down into the chest. So an abscess is caused basically by bacteria getting in and infecting. And how do they get in? They can get in through a cavity. That's really the most common way because cavities are caused by bacteria. And as the cavity gets deeper and deeper, eventually it goes into the nerve space, and then the infection begins. Bacteria can also migrate through a crack in the tooth. So cracks are very, very fine. You'd have to look under a microscope to really see it very well. But bacteria can migrate through that crack and actually get down into the pulp that we were talking about. You can also get a periodontal abscess, which is a gum abscess, and that's where a different mix of bacteria will go down around the gums and penetrate into the bone and out into the face as well in some cases. And so they're both forms of dental abscesses, but they have slightly different causes. And you usually don't have much doubt that you have a tooth abscess once it really gets going, but sometimes it's hard to tell just at first. So if you have a severe toothache, that throbbing, pounding pain that's radiating, that's often an abscessing tooth. If you bite down on a tooth and it's sore, tender, feels almost bruised, or like there's pressure underneath the tooth, that's usually an abscess tooth. Hot and cold sensitivity can tell you that something's starting to happen, but there are other causes of that type of sensitivity as well. It's not always an abscess tooth. Obviously, swelling out into the face, as we mentioned earlier, any type of a fever associated with those symptoms, and lymph nodes that are swollen in the neck or the jaw. Those are all evidence often of some type of an abscess that's forming. So you're definitely at more risk for an abscess if you struggle with your dental hygiene, not brushing and flossing as much. It just allows bacteria to take over and either form gum infections or pulpal infections through cavities. And so if we control the plaque and we try to lower the number of bacteria in the mouth, especially the bad actors, then it can really help cut the risk of infection significantly. And so when you go to see a dentist, which you absolutely should if you have any concerns about an abscess, the dentist will check around the tooth in various ways, probably take a digital x-ray, and sometimes the infection will show up on the digital x-ray, or the deep cavity or deep older filling that's leaking could show up on the x-ray as well. And they may tap the tooth a little bit to see if it's tender, or use some cold, like a little bit of ice, to see if there's any response in the tooth. That can give us some very clear indications. And abscessing teeth don't always feel cold sensitivity. In fact, once they've abscessed and become significantly infected and the nerve has died, you're unable to feel cold. And that's a very important test that a dentist will use to try to determine what's going on with your tooth. And so if you have an abscess, there's various ways of treating it, and sometimes it depends how severe it is. So if there's facial or gum swelling, there can be a small incision made and drainage, because we always want to try to get drainage out of an infection if possible. If it's reached a stage where there is a pus buildup, we want to get some drainage out, so that can be done in various ways. In other cases, a root canal can be done. And a root canal is just accessing the inside of the tooth through a very small hole and cleaning out the internal part of the tooth where all the little canals and the nerve and blood vessel used to be in those canals, but cleaning them out, disinfecting, and sealing them. And that allows you to save the tooth by eliminating the infection that way. And another alternative is to actually remove the tooth. And sometimes that's the only alternative. If a tooth is in a compromised condition and it's not worth saving, then the tooth can be removed. But it's usually an option no matter what the situation is. If you don't want to save it, you don't want to do a root canal, you may be able to remove the tooth. We will use antibiotics depending on the situation. Obviously, you want to be careful with antibiotics, but antibiotics, especially in the penicillin family, can be very effective against these oral infections, and we may need to use them if there's swelling or pain that's developing. We want to get that under control and keep it from advancing. And tooth abscesses aren't usually going to go away on their own. Very, very rarely will they go away on their own. Sometimes if it's a gum abscess, they will, because they'll drain out, but they're usually going to recur again. But you definitely need to get an abscess evaluated by your dentist. A tooth abscess can be very, very serious, actually. Most people don't realize that an infection in a lower molar, especially, that starts to go down into the neck, can then travel down into the chest cavity. Or an infection in an upper tooth could swell up underneath the eye, and if it gets underneath the eye, there's a canal there that goes into the brain, and so that infection can become very, very seriously. So an dental abscess, can actually be a life-threatening or a hospitalization type case. And so if you have an abscess tooth and you've developed a fever, you're flushed, you're tired, you got the facial swelling, and absolutely if you have difficulty breathing or it's hard to swallow, anything that would indicate an infection, that is an emergency, and you should seek care as quickly as possible, because dental infections can advance fairly quickly. So, the best way to avoid an infection is to be preventive. Do everything you can possibly. So you're brushing, you're flossing, you're limiting your sugar exposure. And the other thing, though, that most people don't think about is that you may want to wear a mouth guard when you're playing contact sports, because a traumatic injury that cracks a tooth can lead to a dental infection, or a traumatic injury can actually just shock the internal system in the tooth so badly that it just dies, and then eventually that can become an infection. And of course, you want to visit a dentist regularly to identify problems in their earliest stages, because abscesses tend to be a later stage of dental problems. And so if you have an abscess, treatment is absolutely necessary in some form. And you may be concerned about the cost of a tooth abscess, but it's going to depend on your situation. And often you do have options, like I mentioned earlier. So if you're going to have a root canal, it could be anywhere from $500 to $1,500 plus the cost of the filling or crown that needs to be done afterwards. If you're going to have a tooth taken out, it may cost anywhere from $150 to $500. And so it just depends on your individual situation. And dental insurance is pretty good at helping with dental emergencies and extractions and root canals, but every plan is different. That's something you want to discuss with your dentist. But your dentist is often concerned with getting initial treatment done before moving on to a definitive situation. We want to keep you out of the hospital and get you out of pain and as comfortable as possible. And so there aren't really any great home remedies for a tooth abscess. There are some things you can try, but it should be very, very temporary with a plan to quickly get some help as soon as you can. And so you can do like a salt water or baking soda rinse to help a little bit, especially if it's like a gum infection. Ice compresses, in the area of swelling can be helpful. It's not going to prevent an infection from advancing necessarily, but it can feel better. And there are some other techniques. Some people feel that certain essential oils or coconut oil pulling can help. They're not definitive treatments for an abscess and certainly shouldn't be seen that way. You need evaluation and treatment as soon as possible. So if you have an abscess, if you're concerned about symptoms, then please make arrangements to see a dentist as soon as you can. And if you have swelling or fever, anything more advanced like that, difficulty breathing, difficulty swallowing, a visit to the ER is a wise thing to do. It's just not worth finding out that this should have been treated earlier. So if you are in need of help and you need to get to a dentist, please consider our network at Express Dentists. We have a wide network of dentists and specialists that are available across the nation to provide trusted quality care. So reach out to us and we can help. Take care.